In a 19-page advisory, the Surgeon General, Dr. Vivek Murthy, issued a public warning about the risks of social media use for young people. The warning cited research that suggests social media can have a negative impact on mental health, including increased anxiety, depression, and suicide. Some research also shows that social media use may be perpetuating eating disorders, low self-esteem, and even body dysmorphia. The warning comes as social media use among young people continues to grow. In 2022, nearly 95% of teens use social media. Nearly 40% of children aged 8 through 12 were also found to use social media platforms. He further emphasizes that the brain development in the adolescent population is particularly susceptible to social pressures, peer opinions, and peer comparison, to which exposure is increased with social media. The risks of social media use may be particularly high for young people who are already struggling with mental health problems. Despite this widespread use, we do not yet have enough evidence to determine if social media use is sufficiently safe for children and adolescents. Here are some of the steps that can be taken to protect young people from the negative effects of social media. Limiting the amount of time that young people spend on social media. Monitoring the content that young people are exposed to on social media. Talking to adolescents about the potential risks of social media use. Helping young people develop healthy coping mechanisms for dealing with negative emotions. Providing youth with access to mental health resources if they need them. The advisory also recommends limiting the use of electronics at least an hour before bedtime. The Surgeon General's advisory concludes by calling for a collaborative effort to create safe and healthy digital environments for young people. This effort should involve parents, educators, policymakers, social media companies, and young people themselves. These steps could include developing policies and tools to prevent cyberbullying and harassment, providing more transparency about how their platforms are used and how they collect and use data, investing in research on the impact of social media on young people's mental health, and enforcing minimum age limits. He also urged age-appropriate safety standards for technology platforms. This is in light of the fact that there is an increase in cyberbullying. The Surgeon General's warning is a call to action for all of us to work together to make social media a safe and healthy space for young people. Follow us for more.